Howdy everyone, Matt and Mateo here, coming at you with another special test. This one is for the abdomen. It is Carnett sign or Carnett's test. So this test came from a paper back in 1926 by Dr. John Carnett. And he came up with this test because he had noticed that people were having abdominal pain and were having these surgeries for like appendectomies or gallbladder removal, but they weren't actually solving the issue. So he said, hey, I'm going to develop this test to determine if somebody is having a visceral pain or is it possibly from a nerve entrapment. So if it's from the nerve entrapment, we can avoid having that unnecessary surgery. And this is how you do it. To perform this test, you have the person lying on their back, like Mateo is here. We find that area that is painful, and we palpate it. And we find that tender area. Then what we're going to ask them to do is either to raise their shoulder and head up off of the table, or their legs up, and that just contracts the abs. So if you try that, you'll feel your abs kind of pop up. And if their pain increases, so to say like, oh, I do that, oh, that hurts, it's either consistent or it hurts more, it's a positive, meaning that the abdominal wall is where the pain is coming from. However, if the pain decreases, it's possibly from an organ, that visceral origin of the pain symptoms. So that's how you do Carnett's sign. So getting into the research on this test, it has been found to be very sensitive and very specific. Over 80%, almost 90% for both of them. And it is recommended to be used with any kind of abdominal assessment. So anybody coming in with that, they say to utilize this along with other things. There was an article that they did look at over 1,000 people with an anterior cutaneous nerve entrapment and found that 87% of those people presented with a positive Carnett sign. They did do a study where they looked at using this in the emergency room. So people coming in with abdominal pain in the emergency room, and they said it's not as sensitive or specific in that case. So maybe it didn't work very well. But they did say, again, overall, to utilize this test as part of an assessment for abdominal pain. And I would think it'd be important for us in physical therapy because we have direct access. We see people, somebody comes in, has an abdominal wall pain. We can assess to say, hey, that could be something that we see, or we need to refer you to whatever provider it is that you would need. But anyway, that is Carnett's sign. Let me know, do you use it? Have you ever heard of it? Have you ever had a positive? Anything like that? Let me know down in the comments. And as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.